I'm Sarah Eichmeyer. I'm a physical medicine and rehabilitation doctor who specializes in pelvic floor pain and dysfunction. Pelvic floor musculoskeletal pain and dysfunction are encountered in many physiatric practices, yet our resident physicians report difficulty understanding the unique anatomical features of the pelvic floor and related clinical syndromes. We've been exploring the visualization capabilities of anatomage for teaching our resident physicians three-dimensional concepts. Using the built-in regional scans, I select the pelvic region. The regional scans with the male model is based on photo images versus the female model is CT image based. The male model captures muscular detail much better because of its use of photo images rather than the female CT based model. So first I'm going to rotate the pelvic region of the model using a 2-finger swipe rotating motion, and then bring it over into the center of the screen. And then separating the 2 fingers, you can enlarge the model to fit the screen size. So using the clipping tool, which I'm just going to highlight here, represented by the scalpel, allows the image to be sliced in multiple planes, allowing unique views of the muscular and ligamentous attachments. So first I make a coronal slice, and with a single finger motion rotate the model for a coronal view, which allows visualization as if I'm looking down into the pelvis. From the segmented visibility screen, which is represented down here by the eyeball, the skeletal, articular, and muscular systems will be selected. This allows the best view of the musculature, ligamentous, and joint attachments that I'm focusing on. However, the skin or the integument can be added to keep overall body perspective and relate the model to a real-life patient. However, extra slices at the base of the pelvic floor can be distracting for this demonstration, so I'm going to remove them. Alright, so using the scrolling tool, we'll scroll down to the base of the pelvic cavity and first highlight the muscles of the pelvic floor. I will use the annotation tool to label the pelvic floor muscles. So we first go to the structure menu and then scroll down until we find the muscles that we're interested in. So the muscles of the pelvic floor consist of the levator ani as well as the obturator internus muscles. We can see here the levator ani is the base of the pelvic floor, and then the obturator internus, which I'll highlight in a minute, are slightly lateral on both sides of the pelvic floor. The levator ani, which I'm going to highlight using the pencil drawing tool, is made up of 3 separate muscles: the puborectalis, the pubococcygeus, and the iliococcygeus. Clinically and on this anatomic model, it is difficult to differentiate between the 3 muscle bellies, and they are generally grouped together as a single functional muscle. The levator ani originates on the base of the pubic ramus and inserts on the coccyx posteriorly. The obturator internus is located just lateral to the levator ani, and it's separated by a tendinous arch that runs from the pubic ramus here back towards the ischial spine here. The obturator internus is actually a deep hip external rotator, along with the obturator externus, the gemelli, and the piriformis muscles. The pelvic floor muscles can be palpated on internal vaginal exam in females and internal rectal exam in males. The obturator internus is differentiated from the levator ani by the tendinous arch, and also by having the patient externally rotate the hip, the contraction of the obturator internus can be palpated. Moving back up through the pelvic cavity, it's useful to point out the relationship of the rest of the bony pelvic girdle, comprised of two innominate bones, one on each side, and the sacrum. The pelvic girdle has three joints. The pubic symphysis anteriorly and the two sacroiliac joints posteriorly. The pubic symphysis has an interarticular disc and many ligamentous and fascial connections to the abdominal, hip, and pelvic floor muscles. The sacroiliac joints has a well-formed joint capsule anteriorly, as you can see here, but is more rudimentary posteriorly. Posteriorly is where sacroiliac joint injections are directed under fluoroscopy. I will also use the pencil drawing tool to highlight several muscles of the pelvic region. This is the rectus abdominis and a sliver of the oblique abdominal muscles. Here is the psoas major and the iliacus before they connect deeper in the pelvis to form the iliopsoas muscle. Here are the beginnings of the three gluteal muscles. So here is glute minimus, glute medius, and then this is the beginning of glute maximus. These muscles function as hip extensors and abductors, and as we move deeper down into the pelvis, you can see that the glute maximus here becomes a much more dominant muscle lower down in the pelvic region. The lumbar paraspinal muscles are back here, and you can see they're very well formed in this muscular male model. With this view, I find it useful to add or subtract some other organ systems using the segmented visibility tool represented by the eyeball. So what I can do is add the urinary, genital, and alimentary systems to demonstrate the relationship of the visceral structures to the underlying muscles and bones. For example, I will first just add the prostate and the bladder. So first add the prostate, and then the bladder, which you can see sit in the pelvic cavity anteriorly. I'll also add the alimentary system, and if I scroll down past the small bowel, you can see that the bladder sits anteriorly in the pelvis and the rectum sits posteriorly. If I take away the visceral organs and rotate the model in a coronal and sagittal plane, you can see the relationship of the pelvic floor muscles to the remainder of the abdominal, hip, lumbar spine, and pelvic muscles. This relationship is important because these muscles comprise the muscular core. The core muscles co-contract to provide stability during transfer of energy between the upper and lower extremities, for example with walking, running, or lifting. When there's pathology in the lumbar spine, hip, or pelvis, the pelvic floor muscles can become painful or dysfunctional. So I will make one final cut to the anatomic model using the scalpel drawing tool. in the sagittal plane. Using the pencil drawing tool, I'm going to highlight the mirror image. I'm going to hit the mirror image button here to get this view. And then I'm going to rotate the body so that you'll have a sagittal view of the pelvic cavity. Using the pencil drawing tool, I will highlight the sacrum and the coccyx posteriorly, as well as the pubic symphysis anteriorly. The levator ani forms a bowl of muscles that connect these two bony structures and is highlighted here. Just lateral to the levator ani is again the obturator internus, separated by that tendinous arch. I can rotate the model slightly to show the 3D relationship of the muscles in this plane. This concludes the anatomic demonstration of the pelvic floor muscular and bony anatomy using the anatomage.